Hi everyone, my name is Monica. Today I'm gonna present a Journal 5 assignment. And please excuse me if you hear any crying of baby. I just had a baby 8 weeks ago, and he's not feeling well since couple of days. Okay, briefly discuss a client encounter you had this week and note to the therapy modality used, what the diagnosis was. Um, I I'm going to the clinical at this moment, and yeah, the day before yesterday I did see the cases with um, depressive episode with suicidal thought. But on that we use counseling, specific counseling with CBT, cognitive behavior therapy we use. Now consider how motivational interview would have benefit the client. Describe your comfort level with the motivational interview and how you plan to incorporate into the clinical practice on regular basis. Okay, motivational interview is very interesting topic. It's about started. I would like to start with a brief discussion about it. Motivational interview is a client-centered evidence-based counseling approach that aims to enhance an individual motivation to change behavior or make the change a relatable decision. The key principle of a motivational interview is empathy, all rolling with the resistance, development of disparity, evocation, and collaboration. All those key principles help to open up the conversation in a smoother way, and the patient-client relations become very strong, and you're gonna have very therapeutic relationship with the client. Whenever patient feel comfortable, it will be um, win-win in terms of getting the patient need met and having the individualized therapeutic plan. It will enhance the quality of care, and it will basically lead to most of the time a successful recovery of the client. Typical it usually started with like engaging, focusing, evoke, and plan. At the same time, the technique I usually prefer the most is open-ended question, affirmation, reflective listening, scaling question, and change talk. Motivation interview. In conclusion, motivation interview is a powerful and uh, compassionate approach that can help individuals overcome ambivalence and find the motivation to make a positive change in their life. We can use motivation interview in a different setup. Most of the time, we work with a variety of clients. Especially, I like to use the motivation interview with the addiction, substance use, or smoking cessation plan, which makes them to realize their importance and significant impact of the abusive habit. Um, yeah, I am looking forward to use all the technique, open-ended question, affirmation, reflective listening, and scaling question and change talk. And I hope it will help me to enhance our quality of my service as a provider in future, as well as um, bring a best therapeutic relationship and successful story on patient achievement too. Thank you so much for your time and patience. I appreciate you all. You guys have a blessed day. Bye.